Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. If something feels off in your chest, I want you to pause and pay attention, because your body often whispers long before it screams. Many people believe a heart attack always comes as a sudden crushing pain, but science shows that for millions, especially adults over 40, the warning signs are far more subtle. Pressure, tightness, burning, heaviness, or just an uneasy sensation that doesn't feel quite right. This off feeling is your nervous system sending an early signal. The heart is one of the most highly innervated organs in the body, meaning it communicates constantly with the brain through electrical and chemical signals. When blood flow becomes restricted, even slightly, those signals change. Research published in cardiology journals shows that reduced oxygen to heart muscle, called ischemia, can begin minutes, hours, or even days before a major cardiac event. During this time, symptoms may come and go. They may worsen with stress, walking, climbing stairs, or emotional upset, and ease with rest. That's not random, that's physiology. As plaque builds up in the coronary arteries, the heart must work harder to push blood through narrowed passageways. This increases oxygen demand, but supply can't keep up. The result? Discomfort, pressure, fatigue, shortness of breath, or a vague chest sensation people often dismiss as indigestion, anxiety, or muscle strain. And here's something important. The body does not care what you call the symptom. If blood flow is compromised, damage begins at the cellular level. If your chest ever feels off, not painful enough to panic, not dramatic enough to stop your day, just different, heavy, tight, warm, pressured, uneasy, or wrong in a way you can't fully explain, that moment matters more than most people realize, because the heart almost never fails without first trying to warn you, and those warnings are rarely loud. They are subtle, quiet, and easy to dismiss, which is exactly why so many people miss them. Medical research shows that for a large percentage of heart attack victims, the body begins sending signals days or even weeks before the actual event, signals that are brushed off as stress, indigestion, anxiety, muscle strain, or just getting older. But the heart does not speak the language of excuses. It speaks the language of sensation. And when blood flow is compromised, even slightly, the body knows. The heart is not just a pump. It is a highly sensitive electrical organ with millions of nerve endings constantly communicating with the brain. And when oxygen delivery drops because coronary arteries begin to narrow, those nerve signals change, creating sensations that feel unfamiliar, uncomfortable, or simply off long before irreversible damage occurs. Studies published in cardiology journals have documented that myocardial ischemia, reduced blood flow to the heart muscle, can occur intermittently at first, especially during physical exertion, emotional stress, or after heavy meals. And during these early stages, pain may not be sharp or crushing. It may be a dull pressure, a squeezing feeling, a fullness in the chest, or an odd discomfort that comes and goes. This is where danger hides, because humans are conditioned to wait for extreme pain before taking action. Yet the heart does not operate on Hollywood rules. It operates on cellular survival, and heart muscle cells begin to suffer within minutes of oxygen deprivation, even if the sensation feels mild. Research has shown that plaque buildup in arteries can restrict blood flow by more than 50% before a person feels classic chest pain, meaning the heart may already be under strain while the mind remains unconcerned. And during this time, the body often compensates by increasing heart rate and blood pressure, which further stresses the cardiovascular system. This is why people often report feeling chest pressure when walking uphill, climbing stairs, or feeling emotionally upset, then noticing the sensation ease when they rest. That pattern is not coincidence. It is physiology, and it is one of the most overlooked warning signs of an impending cardiac event. Even more alarming is the fact that many heart attacks are preceded not by pain, but by vague discomfort, fatigue, shortness of breath, nausea, sweating, or a sense of impending doom, sensations that do not seem serious enough to justify concern, yet are strongly associated with poor blood flow to the heart. In fact, Studies involving thousands of patients have found that up to 70% of people who suffered heart attacks experienced warning symptoms beforehand, but fewer than half sought medical attention, often because the symptoms were not severe or dramatic enough to feel urgent. The heart, unlike bones or muscles, does not scream immediately. It whispers, because its primary goal is to keep you alive while adapting to stress. But adaptation has limits, and when those limits are reached, damage becomes sudden and severe. What makes this even more dangerous is that the brain is incredibly skilled at rationalizing discomfort, especially when it interferes with daily life, telling you it's just heartburn, just anxiety, just fatigue, just another bad day. But heart muscle cells do not care about explanations. They care about oxygen. At the cellular level, when blood flow drops, heart cells switch from efficient energy production to emergency survival mode, producing lactic acid and disrupting electrical signals, which can lead to arrhythmias, weakness, dizziness, and sudden collapse if ignored long enough. Autopsy studies of sudden cardiac death victims often reveal extensive arterial disease that had been developing silently for years, while symptoms were present but unrecognized, misinterpreted, or ignored, not because people were careless, but because the warning signs were subtle and confusing. This is especially true for adults over 40. People with high blood pressure, diabetes, smoking history, chronic stress, or sedentary lifestyles, where chest discomfort may feel routine rather than alarming, yet the risk is significantly higher. Women, in particular, are more likely to experience atypical symptoms such as chest tightness without pain, upper back discomfort, jaw pressure, nausea, or unexplained fatigue, which leads to delayed treatment and worse outcomes despite similar underlying disease. What makes early attention so powerful is that heart damage is dose dependent. The longer oxygen is restricted, the more muscle is lost, and once heart muscle dies, it does not regenerate. It is replaced with scar tissue that weakens the heart forever. Medical imaging studies show that patients who seek help during early warning phases preserve significantly more heart function than those who wait until pain becomes unbearable, meaning early listening can literally save heart muscle. This is not about living in fear. It is about learning fluency in your body's language, understanding that off does not mean imaginary, and discomfort does not need to be dramatic to be dangerous. The heart does not send warnings to scare you, it sends them to protect you, giving you time to slow down, get evaluated, restore blood flow, and prevent catastrophic damage. Ignoring these signals does not make you strong. It makes you vulnerable because the heart keeps working until it can't. And when it stops compensating, the collapse is sudden and unforgiving. Every year, millions of heart attacks could be prevented or reduced in severity if early warning signs were taken seriously. A fact supported by decades of cardiovascular research and public health data. If your chest feels off, different from your normal baseline, especially if it appears with exertion, stress, or fatigue, that is information, not inconvenience. And information gives you power. The heart warns before it breaks, but only if you are willing to listen. And that willingness can mean the difference between a temporary scare and a permanent loss of health, independence, and life. Your body is not betraying you when it sends these signals. It is trying to save you quietly, patiently, one sensation at a time, hoping you will pay attention before it has no other way to speak. What most people never realize is that heart attacks don't begin in the emergency room. They begin quietly years earlier in daily habits so small they seem harmless, choices repeated over and over that slowly shape whether heart cells thrive or suffocate, and science now shows that the heart is not destroyed in a single moment. It is worn down day by day, long before the final crisis ever arrives. Every beat of your heart depends on a constant supply of oxygen and nutrients delivered through blood vessels lined with a fragile inner layer called the endothelium. And when that lining is healthy, blood flows smoothly, pressure stays balanced, and heart cells remain strong. But when daily habits damage that lining, the process of heart disease quietly accelerates. Research published in major cardiovascular journals shows that chronic low-grade inflammation is one of the primary drivers of arterial damage, and this inflammation is not caused by sudden trauma. It is fueled by what you eat, how you move, how you sleep, and how your body handles stress every single day. One of the most powerful protective habits ever studied is regular consumption of extra virgin olive oil, a food so simple that many people overlook its impact. Yet large population studies, including those following Mediterranean communities for decades, show dramatically lower rates of heart attacks, strokes, and sudden cardiac death in people who use it daily. The reason lies in olive oil's polyphenols, compounds that actively reduce inflammation, protect LDL cholesterol from oxidation, and improve nitric oxide production, a molecule essential for relaxing blood vessels and maintaining proper circulation. And when nitric oxide levels are healthy, the heart does not have to work as hard to push blood through the arteries. Clinical trials have shown that just 1 to 2 tablespoons of extra virgin olive oil per day can significantly improve endothelial function within weeks, meaning the inner lining of blood vessels becomes more responsive and resilient, reducing the likelihood of plaque rupture, the event that triggers most heart attacks. Magnesium is another silent protector, yet studies show that a large percentage of adults are deficient without knowing it, and magnesium deficiency is strongly associated with high blood pressure, irregular heart rhythms, coronary artery spasms, and increased risk of sudden cardiac events. Heart cells rely on magnesium to regulate calcium flow, which controls contraction and relaxation. And when magnesium levels are low, the heart becomes electrically unstable, increasing the risk of palpitations, chest tightness, and dangerous arrhythmias that can strike without warning. Foods rich in magnesium, such as leafy greens, legumes, seeds, and nuts, have been shown to lower cardiovascular risk by improving vascular tone and calming the nervous system. Yet many modern diets strip these foods away, replacing them with processed options that actively deplete magnesium stores. Daily movement is another powerful medicine that works at the cellular level because moderate physical activity increases mitochondrial efficiency inside heart cells, allowing them to produce energy more effectively with less oxygen demand, making the heart more resilient under stress. Studies using cardiac imaging show that people who walk briskly for just 30 minutes most days have better coronary circulation and reduced arterial stiffness compared to sedentary individuals, even when other risk factors are present. Sleep, often ignored, is one of the most underestimated heart protective habits because during deep sleep, the body repairs vascular tissue, balances hormones, and reduces inflammatory markers that directly damage arteries. And chronic sleep deprivation has been linked to increased plaque buildup and higher rates of heart attacks. Research shows that sleeping fewer than 6 hours per night significantly increases the risk of coronary artery disease, not because of fatigue alone, but because the heart never fully recovers from daily stress without adequate rest. Stress itself is not just emotional, it is biochemical, and chronic stress floods the body with cortisol and adrenaline, hormones that raise blood pressure, constrict blood vessels, and increase heart rate, forcing the heart to work harder while receiving less oxygen. Long-term studies reveal that people with unmanaged stress have higher rates of heart disease even when diet and exercise are controlled, showing that the nervous system plays a direct role in heart health, not just lifestyle choices. This is why simple breathing practices have measurable effects on the heart, because slow, controlled breathing activates the parasympathetic nervous system, lowering heart rate and blood pressure while improving heart rate variability, a key marker of cardiovascular resilience. Research has shown that just 5 minutes of slow diaphragmatic breathing can immediately reduce blood pressure and improve oxygen delivery to heart tissue, a powerful reminder that the heart listens closely to the rhythm of your breath. What makes these daily habits so powerful is not that they prevent every problem, but that they strengthen heart cells before crisis strikes, giving them more tolerance, more flexibility, and more survival capacity when blood flow is challenged. Autopsy studies of individuals who died suddenly often reveal that those with healthier lifestyles had smaller areas of heart muscle damage, suggesting that daily habits can limit the severity of cardiac events even when disease is present. The heart does not fail suddenly without context. It fails when years of inflammation, nutrient deficiency, inactivity, stress, and poor sleep overwhelm its ability to adapt, and by the time pain appears, much of the damage has already been set in motion. This is why prevention is not about perfection. It is about consistency, because heart cells respond to patterns, not occasional efforts, and small daily actions repeated over time create profound biological effects. Choosing anti-inflammatory foods, moving your body, sleeping deeply, managing stress, and supporting circulation are not lifestyle trends. They are cellular instructions that tell your heart how to survive. Every healthy habit sends a message to your heart that resources are available, oxygen can flow, and stress can be managed, allowing heart cells to function efficiently instead of constantly fighting for survival. Heart disease is not just a matter of genetics or bad luck. It is largely shaped by daily choices that either protect or slowly erode the cardiovascular system, a fact supported by decades of research across cultures and populations. Your heart is listening every day, responding to what you eat, how you move, how you rest, and how you breathe, and while it may forgive occasional mistakes, it never ignores long-term patterns. The shocking truth is that many heart attacks are not inevitable. They are the final outcome of years of silent strain, and daily habits are the most powerful tools we have to change that outcome before it becomes irreversible. Protecting your heart is not about dramatic interventions. It is about quiet, consistent actions that strengthen heart cells long before they are pushed to their limits, giving you time, resilience, and life. Listening early can save heart muscle, and saving heart muscle means saving years of strength, independence, and life itself. Yet modern medicine continues to see the same tragic pattern repeated over and over. People feel something is wrong, something subtle, something uncomfortable, something they cannot quite explain, and instead of acting, they wait, and that waiting quietly determines the outcome. The science is unforgiving on this point because heart muscle is not like skin or liver tissue. It does not regenerate once it dies, and every minute that blood flow is restricted, heart cells are lost permanently, replaced by scar tissue that weakens the heart's ability to pump for the rest of a person's life. Cardiology research shows that irreversible damage to heart muscle can begin within just 20 to 30 minutes of severe oxygen deprivation. And while early warning phases may not involve total blockage, they represent a critical window where intervention can dramatically change the future. This is why doctors say time is muscle, because the faster reduced blood flow is identified and treated, the more heart tissue survives, preserving strength, rhythm, and circulation long after the crisis has passed. Imaging studies using cardiac MRI reveal a stark difference between patients who seek help early and those who delay, with early responders showing smaller areas of damage, better ejection fraction, and significantly lower risk of heart failure in the years that follow. Heart failure is not a sudden disease. It is often the long-term consequence of ignored or delayed heart attacks, where scar tissue accumulates slowly, reducing the heart's ability to meet the body's demands, leading to fatigue, breathlessness, swelling, and loss of independence. Public health data shows that nearly half of heart attack deaths occur before a patient reaches the hospital, not because treatment is ineffective, but because warning signs were missed, dismissed, or ignored for too long. When early symptoms are recognized and acted upon, modern treatments can restore blood flow, stabilize heart rhythm, and prevent extensive damage, turning what could have been a life-altering event into a manageable medical episode. The shocking truth is that many heart attacks are survivable with minimal long-term damage if treated early, yet become devastating or fatal when delayed. Not because the heart failed suddenly, but because it was not given help in time. Listening early also protects the brain, kidneys, and entire vascular system, because the heart is the engine that powers every organ. And when it weakens, the ripple effects spread throughout the body. Studies show that patients who delay care are more likely to suffer complications such as arrhythmias, cardiogenic shock, and stroke, while those who respond early often return to normal life with little or no lasting impairment. There is also a psychological cost to delayed action, because surviving a severe heart attack often leads to chronic anxiety, depression, and fear of recurrence, conditions strongly linked to poorer recovery and shorter lifespan. Early intervention changes that narrative, allowing people to recover confidence in their bodies, maintain physical activity, and preserve quality of life rather than living in constant fear of another event. One of the most overlooked benefits of listening early is that it gives doctors more options, because early-stage ischemia can often be managed with medications, lifestyle changes, and monitoring rather than invasive procedures or emergency surgery. When patients wait until collapse, treatment becomes aggressive and risky, involving stents, bypass surgery, prolonged hospitalization, and lifelong medication dependence that might have been reduced with earlier care. Scientific studies consistently show that people who respond promptly to warning signs have lower healthcare costs, fewer hospital readmissions, and longer survival. A reminder that early action benefits not just the heart, but the entire life trajectory. Listening early also means learning to respect the body's internal signals rather than overriding them with logic, denial, or distraction, because the body does not create symptoms without reason. Chest discomfort, unexplained fatigue, shortness of breath, dizziness, or nausea are not inconveniences. They are biological messages generated by complex feedback systems designed to protect vital organs. Ignoring these messages does not make them disappear. It only delays the moment when the body is forced to escalate its warning, often through catastrophic failure. Medical records reveal countless cases where patients later say, "I knew something wasn't right," a sentence that echoes through emergency rooms and intensive care units worldwide, carrying the weight of regret and missed opportunity. Listening early is not about panic, it is about respect, understanding that your body is constantly monitoring itself and offering information long before disaster strikes. Education plays a critical role here, because people who understand heart warning signs are far more likely to seek timely care. And studies show that awareness campaigns significantly reduce mortality rates in communities where they are implemented. Even something as simple as trusting your instincts can be life-saving, because research shows that many patients accurately sense danger before clinical measurements become severe. The heart has an extraordinary ability to adapt and recover when supported early, rerouting blood flow, stabilizing rhythm, and healing surrounding tissue, but that ability diminishes rapidly when damage becomes extensive. Listening early does not guarantee immortality, but it dramatically shifts the odds, turning silent damage into manageable disease and sudden death into survivable events. The difference between a scare and a catastrophe is often measured in minutes, and those minutes begin when the body first speaks. When people learn to respond early, survival rates improve, recovery is faster, and lives are extended not just in years, but in quality, mobility, and independence. The greatest tragedy in heart disease is not that it exists, but that so much of its damage is preventable with timely attention. Your heart is not fragile, it is resilient, adaptive, and powerful, but it relies on you to listen when it asks for help. Listening early is an act of self-respect, a decision to value your future health over temporary discomfort or inconvenience. It is choosing to believe that subtle signals matter, that your life is worth responding to, and that prevention and early care are among the most powerful medical tools ever discovered. When you listen early, you give your heart a fighting chance, and that chance can mean more time, more strength, and more life than you ever thought possible.